How can I explain my bladder cancer type to family? Explaining your bladder cancer to family can feel overwhelming, but breaking it down into simple, clear parts can help them understand your situation better. First, start by explaining what bladder cancer is. It's a disease where abnormal cells grow uncontrollably in the bladder, which is the organ that stores urine. Think of the bladder as a balloon that holds your urine until you're ready to go to the bathroom. When cancer develops there, it usually begins in the lining of the bladder. Next, tell them about the specific type of bladder cancer you have. The most common type is called urothelial carcinoma, also known as transitional cell carcinoma. This type starts in the cells lining the inside of the bladder. It accounts for about 9 out of 10 bladder cancer cases. There are other less common types, but urothelial carcinoma is the main one most people are diagnosed with. It's also helpful to explain how doctors classify bladder cancer. They look at whether the cancer is confined to the lining or has grown deeper. If it's only in the lining and hasn't invaded the muscle layer, it's called non-muscle-invasive bladder cancer. These tumors often appear as small growths called papillary tumors or flat areas called carcinoma in situ. This type usually has a better outlook and might need less aggressive treatment. If the cancer has grown into the muscle layer of the bladder wall, it's called muscle-invasive bladder cancer. This type is more serious because it has a higher chance of spreading to other parts of the body. When cancer spreads beyond the bladder to nearby tissues or other organs, it's called metastatic bladder cancer. You can also mention the grade of the cancer. Low-grade cancers look more like normal cells and tend to grow slowly. High-grade cancers look very different under the microscope and are more likely to grow quickly and spread. Knowing the grade helps doctors decide on the best treatment. If you know your cancer stage, share that too. The stage describes how far the cancer has advanced. For example, stage I means it's still in the lining or just under it, while stages Roman II and higher mean it has invaded deeper layers or spread further. Using simple analogies can help. You might say, imagine the bladder wall like a layered cake. My cancer is only in the top layer, so it hasn't gone deeper yet. Or, my cancer cells look very different from normal cells, which means they might grow faster. Reminded your family that the type, grade, and stage of your cancer are important because they guide your treatment plan and help predict your outlook. It's okay to tell them that doctors use these details to decide whether you might need surgery, chemotherapy, or other treatments. Finally, encourage questions and share your feelings. Let them know it's okay to ask questions and that their support means a lot to you. Explaining your bladder cancer in simple, honest terms can help your family understand what you're going through and how they can support you best. Always remember to consult your healthcare team for specific details about your diagnosis and treatment options.